There we are, we're recording. So thank you everybody for coming to this Heart of Thriving Zoom with very special guest, Mary Franklin Smith. Could I ask that you mute yourselves unless you're speaking, please, just to keep background noise to a minimum. That would be great. And there'll be a chance, in fact, there'll be a chance to ask questions as we go along. So this will be very informal. Mary said she's happy to kind of make it very interactive and two-way. So here we go. Thank you so much for doing this, Mary. I'm delighted that you're here with us.
Thank you.
There will be a description of Mary and what she does in the recording and a bit more details about her. But why don't you just start, Mary, by telling us a bit about what you do and your kind of journey from coming across this understanding. What was it, 3 years ago, 4 years ago now?
4 years ago now, yeah, 4 years ago.
Wow.
Yeah. Okay, yeah, sure. So let's start with that. So I lots of things. I suppose the most important thing to say for this call is that I have been working in the NHS altogether for about 14 years now in specialist mental health services. So I worked in a CAMS forensic service for a while inside a young offenders prison. And then I now work in a specialist eating disorder service for adults, which is called Connect up here in Yorkshire. And Anthony, who's in the call just there, he works alongside me in the team. We sit next to each other in the office. So it's lovely to have you here, Anthony, and just jump in anytime. So about 4 years ago, I came across this understanding. I was on maternity leave at the time from my third child. I wasn't having as good a time as I thought I would after the third child, and went on holiday with a really good mutual friend who had just been on one of Kimberley's workshops. And at the time, I just was low in mood, I suppose you would say, and struggling. And I kind of was saying to my friend, "Oh, I'm not having a very good time. I wonder if I've got a bit of postnatal depression." And the story goes that he said, "You're all right." And that made me very angry because at the time I wasn't feeling all right. And with time and compassion from him, he was kind of basically giving me the message that whilst I was experiencing, a struggle, actually deeply, I was okay. And then he was telling me about the 3 principles. And that's how it started. So I am a drama therapist. I trained in drama and movement therapy. And in drama, I don't know if anyone knows anything about drama therapy, but just as a very quick overview of what drama therapy aims to do, it aims to use metaphor to talk about a person's unconscious and a person's in the form of therapy that I've been trained in. It's called sesame drama and movement therapy, because we talk about open sesame, open the sort of cave of treasure, if you like, to the person's intuition. So I was trained in that however long ago, and thought that was a really lovely idea until this understanding made me realize that that wasn't just a lovely idea, that was true. And it was the first time that I can say honestly that I had real clarity on what it was that they were trying to teach me when they were teaching me about Jung whilst I was doing my master's. And I really understood it sort of on a personal level properly for the first time, or started to. And so I sort of went back to work and was really, really excited, because I was super keen to share this understanding with pretty much anyone that would listen. And even those who perhaps didn't want to listen, because I was just really excited about what it would mean for our mental health service, and what it would mean for my patients, what it meant for me, for the colleagues. And so over the last 4 years, we've gone on a real journey, because if any of you know anything about working in the NHS, you'll know that there, for good reason, are lots of pathways and procedures, and there's lots of talk about evidence base. And I was going back to the team, kind of sharing this understanding, but at the time wasn't sure what I thought about where it would fit into what we were already doing in terms of therapies. Wasn't really sure what I was calling it. And understanding, people kind of look at you and go, say more. So was advised by our wonderful clinical lead at the time, Dr. Rhys Jones, to go ahead and see what else was happening in terms of the use of this understanding in NHS services, and was advised to go ahead and do what they call a scoping review, which is literally looking for all the sort of peer-reviewed journal articles that have been published talking about use of this in a specialist service. So that was the first sort of hoop to jump through. And then we went to, under what we call a service evaluation framework, looking at service evaluation and looking at where this would fit in if we were to do a piece of research and development on it. So we got the research and development team involved, and then Sarah Parker and myself, who isn't here tonight but is well known to yourself, Kimberley, and obviously Anthony too. She and I together did a group for patients and did before and after outcome measures for that. And on the back of that, we had a meeting in the senior management group about what we would do, given that enough people were finding this useful, whether that was staff or patients, or interesting. And a lot of people were saying, enough people were saying that they found it helpful for us to do something more. So what was agreed at that point, which was earlier this year, was that we would offer what we call Innate Health Days to all patients across the service.
So now we have a proper name that you've agreed on.
Yeah, absolutely. So, anyone on this call who knows anything about the principles will know that we can call it the Heart Thriving, we can call it Serenity Principles, 3 Principles, Clarity.
Inside out, understand.
Inside out, exactly. So, and one of the first things that people said to me, which I kind of understood, was, well, why is it called all these different things? What's that about? So we decided that in a service that was for people who had eating disorders, a specialist mental health service, that to talk about it as innate health was in line with our hopeful stance and our idea about everybody being able to recover. So that's the name we focused on, Kim. And we did an Innate Health group for patients, and we've now had it agreed, and we are going ahead with our first Innate Health Day for any patient in the service. So that's inpatient, outpatient community. And we are also doing a 2-day event in November this year for all staff. So all staff have been invited to that across the service, and some members of the executive committee at our trust are. And in fact, the CEO is coming along to that too.
Brilliant.
And that's going to be hosted with Amy Johnson, who's coming over to do it with us for America, given her the fact that she's a psychologist and her experience with eating disorders. So that's where we're up to, which is cool when you talk about it like that, because it's it's taken time, but we've certainly come on quite a long way. And just this morning, Anthony, myself, and 2 others from the team who share this in their work did a sort of training event for our inpatient colleagues. So we're up and at it, aren't we, Anthony? It's happening. We're lots of conversations, lots of tweets about it in our social media, and we have social media pages and Instagram pages for our patients, and we're often, I would say, you and I are always informed by this, Anthony, when we share on there. So it's really exciting, I think.
Yeah. So what is it like for? And I know people on this call do have, I guess, varying levels of understanding. But what, in your context, what are the main benefits, or what difference does it make for people who come to your service for support and help? Does that make sense?
I tell you what I think it is that it's about them being with somebody who knows that they can recover. Doesn't, hope, believe that they might be able to, but knows that that is absolutely possible. It doesn't mean that they will.
No.
Let's just be clear about that. You know, it doesn't mean that they will see this, doesn't mean that they will, you know, fully recover, whatever that means to them from their eating disorder, but it means that they can. And, you know, so obviously when you're with somebody who knows that you have health at your core, the way that you talk to them, that they talk to you, there's a different relationship. And I think for me, it was really about kind of seeing, and it took some time for me to see this, that some people see this way of living, this way of understanding themselves, their psychology anyway. They see it, they saw it through a different framework, they saw it through some other life event or some other teaching. And to me, and what I say when I talk about this now, is this is a door in. And it's, as you say, Kim, you know, you remember you have that sun in your workshops and you're pointing towards something. It's like, let's not get caught up here on the language if we can. It's so hard. But the language can get in the way. The language can trip us up. You know, when I talk about mind, I know what I mean, but that can mean something completely different to somebody else. And at first, I think I was probably a bit kind of, I don't know. I loved it so much that I was like, oh, it's, you know, this is the way to see it. But it's one way to see it. And I feel like that's really important now when I share this. It's like, you know, it's what I'm pointing towards that is exciting here. And I happen to think that the 3 principles or the innate health understanding is a very simple way into this, but you might not. So let's not toss all the coin there. So I think that's the first thing. And I also just wanted to sort of go back a step and say that we are part with Giles Croft, who I see is kind of on the call. I'm not sure if he's here. We are forming a group of sort of across trusts, multidisciplinary. Here comes Jess, she's from our team too. Multidisciplinary sort of group of people in different trusts in the NHS who are sort of wanting to share this specifically in the NHS. And we're working together to, you know, try and we're sort of the iHeart work in education is sort of a framework, trying to come up with something that might be like that for NHS staff too. So that's another thing that's happening. Yeah,
that's really exciting. Brilliant. So say, because I know you're very interested in the language thing, can you say more about the language you use with your what do you call them? Clients?
Patients. Yeah.
Patients.
Yeah. So I guess what we do when we talk, as you know, whatever therapy you're doing or whatever intervention you're doing, whether it's in an eating disorder service, whether you're a mental health nurse or a dietitian or a psychologist or a doctor or a health support worker, or whatever it is, don't want to leave anybody out. You will be talking to them about their understanding of what and who they are, their identity. And you will be talking to them about how eating disorder can feel like it's taken over that person's sense of identity. And what you will get when you speak to somebody who, or often you will get when you speak to someone who has an eating disorder, especially if they've had it for a while, is sort of a fear of letting that go.
Yeah.
Because you know what, it came into a person's life in a moment as a way of coping with something, whatever that might be, and that is varied, it's absolutely endless. But it did present itself as a way of maybe making somebody feel more powerful, or as maybe giving them a way of communicating something that's going on for them. Maybe letting other people know that they weren't okay. So, you know, symbolizing distress, whatever the sort of function of their eating disorder was, it sort of came in as a way of helping, I suppose, at one point, and then sort of carried on and on and on to a point where it wasn't helping anymore, but they weren't quite sure what to do and how to let that go. So I guess as in the work, I sort of see it like this, and this is stolen from Amy Johnson, but this really clicked with me when she was sort of said, let's talk about somebody's experience. And that's really important to sort of say, okay, so where has this come from, and what's keeping this going, and you know, what function does it play, and what's making it hard to move away from it? So let's talk about the eating disorder. Let's talk about that distress. Let's understand that. But what this understanding did for me was made me see very clearly that what's equally as important as that, or perhaps even more important than that, is to talk to them about this identity. So if we've got this identity being the eating disorder, the current thinking, the personal thinking, the experience, moment by moment experience, we also have this identity, which is the true nature, I suppose. Yeah. The fact that you think, the fact that you are conscious, the fact that you have created and do continue to create moment by moment this feeling connected, everything. Yeah. And what we were saying in this session this morning was, get really interested in that. Absolutely. Understand that, be compassionate about that, listen deeply to this, but never lose sight of this, and don't be shy about pointing this part out. Yeah. This part of the person that is innately healthy, this part of the person that deep down knows what it is that they need, what it is that they want. Because if we just point this bit out, then this bit gets overlooked, and that, I think, in answer to your question, I hope, Kim, is the thing that this has given me in terms of my work. Is it's given me a way of saying, let's understand what's happening here. Let's understand this together, the universal element of this together. And then let's use that shared understanding to maybe let us go there with this as our foundation. Does that make sense?
Yeah, absolutely. Absolutely. Brilliant. I just wanted to give the opportunity to Anthony or Jess to come in if there's anything you wanted to add from your perspective, because working in the same service.
Yeah, I mean, internet connections build.
Yeah. Oh, what a shame. Or maybe type something, Anthony. Type something in the chat box if you want to, and I'll
okay.
read it. How about you, Jess?
Figuring out how to unmute. Sorry for joining late.
That's all right. Lovely to see you.
Yeah, you too. I'm still figuring out the how to share it, because, to be honest with you, if I say what I see, I get a bit I get a bit lost. So for me, it's been the confidence to show up that's had the most profound impact on me. And I work on the inpatient branch of this service, which is part of the same service, but it's like a really intense environment that is just filled with anxiety and filled with the problem. And the whole environment up there is about exploring the problem. And just going in and not being problem focused gets noticed. And so that's how I share it at the moment. I try and offer something other than going in and looking at the problem, trying to offer a solution, or just even showing up in a different way from often other people who are caught up in their thinking. Don't get me wrong, I get caught up in it all the time. But I think just going in and I don't know what to say. Just going in and being myself makes the biggest difference for me. Because I go in as the role of dietitian, people really find it hard to look past my role. So yeah, that's a bit of a barrier for me at the minute. But yeah, I don't know. It's just helped me to get. I think if I hadn't had this understanding, there's no way would I still work there, because there's just no way. There's no way would I would have been a nervous wreck by now.
Yeah. Brilliant. Yeah, so Mary, that's obviously really important, and I know as a coach and lots of other people on the call are coaches as well. It is so much about that, isn't it? It's about how we show up, soul to soul, human to human with that person, rather than it being just a series of protocols or processes.
Yeah, and I want to sort of jump in, Jess, and obviously this is being recorded, and hopefully we're going to share it with our colleagues. And I know that you think this, Jess, and I want to sort of offer a reflection on what you said, Jess, in that I've just spent one day on the ward last week, and it's tough out there. It's tough for everybody, isn't it? And I do think that we all do our best, and I think there's lots of staff in our service who share hope. And what I don't want, Kim, is for this to be like, oh well, we've got this, so we're doing it right. And do you know what I mean? I'm keen for that, because I think that we all, as you say, Jess, you get caught up, I get caught up, and this offers a sort of, I think, an anchor for me, and I think other people have other anchors, and I just sort of wanted to put that out there too as part of this. But yes, absolutely, it's about the connection, it's about human to human, it's about, so one of the things that I do at work is I talk about, I lead on mantra therapy, which is one of the NICE guidelines therapies for people with anorexia, and that's a manualized therapy, and I love it. I think it's great. I think it's got so much to offer, but it's about, it's like, I was thinking about this today, I was thinking I don't know what the saying is, but something about a good workman doesn't blame his tools or something like that. It's like that's a tool for us, but it's us that brings that to life. It's our therapeutic relationship that's the key there. And the therapy, whatever it might be, the pathway, whatever it might be, is going to be as enlivened and as hopeful as the people that are sharing it together. And I think that's the thing, as you were saying, Kim. Yeah,
Brilliant. So we have a question from Giles, who says he is properly here, but he's in the middle of making his tea.
Oh, thank you, Giles.
Doesn't want to be a distraction, but he has a question. How do you point to someone's innate health when they're so convinced that they're broken and they are their condition? I'd love to hear how you really point to the well-being.
Okay. So that's kind of the day-to-day work minute, to be honest. So I feel like I can talk to that. And first of all, I would say that the most important thing is for me to know that whilst that is the person's experience, that isn't the whole of them. So how I do that in each moment will be led by hopefully by me connecting with my intuition and saying whatever it is that occurs to me in that moment. And sometimes, and again, I love it. I met up with a Sesame colleague not so long ago, so it's a drama therapy colleague, and he had seen loads of this during our training. I was like, I didn't get it then. But in Sesame therapy, we talk about look for the golden moments. So, it's like we're in this intense conversation and you're very distressed, and we're with that and we're working with that. And then it starts to hail outside, for an example. And we both notice that, or a bird flies into the room, or something happens that breaks it just for a moment. And an example of this recently was that we were in this conversation and a huge spider ran across the floor. And I have a lot of thinking about spiders, and I jumped up on my chair. And my patient, I just sort of that moment. Were you experiencing yourself as all the ways you were feeling when you came into the session? In that moment, were you feeling lost? In that moment where you got an identity was the eating disorder? So in that moment, in that moment, I was, in charge. And so it's just little things that happened, pointing them out, even if they're just a second, they're a snap, and going, so in that moment, your experience wasn't of yourself in that identity, which must mean something. It might mean that it's not fixed. It feels present. It feels overwhelming. It's not to Giles. It's just looking for those golden moments, pointing them out, and not or whenever it feels right. And at the same time, know that that you know that the weather changes, and that at some point it can and will for that person, and just knowing that, I think, brings a different quality for me. I don't know if that answers it. I can't see what he's writing.
Yeah, no, he said, I love that. The fact that it's not always true, even though they have thought it was always true. You know, it seeing for themselves that it is. Yeah, excellent.
And then going into sort of talking about, you know, the innocence of that too, you know, and how we have these brains, and how when you do something for whatever it is, whether it's tying your shoelaces or driving on the right side of the road, you do something, it becomes habitual. It slips into our unconscious, and we think that that's who we are, you know, and that's okay. That's not a judgment. That's not a, you know, that's just the way it is, and that's what happens. But it's lovely I love surrounding myself with people who don't take that for who I am, and who will say things like, okay, you know, speak to my colleagues, and I'll say, okay, so that's how it looks right now. That won't be how it looks tomorrow, which is a very different conversation than someone who goes right in there with you and doesn't remind you of that. And I think it's really lovely to be reminded of that when you're in a thought storm, not because I necessarily want someone to try and pull me out of it. Sometimes I just want someone to sit in it with me. So all that stuff hasn't disappeared. That thing about listening deeply and having compassion, and sometimes just sitting in a cave with somebody and just being there with them, that's all still true. But it's knowing that it's not a permanent fixed thing. I think that is, for me, that's the biggest thing, really. And also, because I see that in somebody, the way that I feel like I can maybe challenge their thinking or help them to explore it is different. You know, I'm not walking on eggshells like I was. I think I was doing that before. And I have respect for their resilience.
Yes.
And their bounce back ability. And therefore I might say things that I just wasn't saying before. And the reason I do that is not because somebody's told me that I should do that, but because when that's happened to me, like with your good self, Kim, who several times has called me out on my own bullshit, that has been the most helpful thing. You know, that's great. In fact, there's Rebecca. She's here now. Hi, Rebecca.
Yeah.
Rebecca did that with me yesterday. I love it, you know, and it's not that it stops. For me, it's not that it stops. I don't stop getting caught up in my thinking. People still get caught up in their thinking, but that's what's happening. And when you know that that's what's happening, you have a common language.
Yeah.
And I think you can challenge each other in a different way, I think. Yeah.
And I'm just curious, now I'm going to, if it's all right, Mary, throw it open for everybody's questions. Hopefully they've got some. Be thinking of great questions, everybody. But I'm curious about, you know, sometimes when I talk about this understanding, there are these two things. So there's the, first of all, you know, the innate health, the innate resilience, the innate okayness and wellness, and you know, that true nature part. And then the other big piece is the inside out nature, you know, the, like how it works in terms of experience getting created. And I absolutely see how that first one I just mentioned probably has more, you know, immediately more to offer in the context that you work in. But I'm just wondering if, to what extent you kind of help people see where their whole experience is coming from in terms of how like even their relationship with their body, which is essentially outside in rather than inside out. You know?
Yeah, love that, absolutely. And you know, yeah, thank you for saying that, because that has been a wonderful part of this for me too. So things like someone saying, which of course they do because this is how it looks to them, I'm frightened of that food group, or I'm frightened of, you know, eating out or whatever in public, and just being able to point out to someone that so oftentimes you can talk about someone's fear about a certain food group, and of course they will experience the feeling of the fear without the food being anywhere in the room. and just pointing out that if it was the food that you were frightened of, then you would need the food to be here. A bit like Michael Neal said in his TED talk about the spiders.
Yeah.
But often you will see people having that reaction and flushing and whatever when you start talking about certain food groups. Jess will be able to talk about this. And then just pointing out, okay, so it can't be that food that you're frightened of. It must be you're thinking about that food. And if it's you're thinking about that food, it's also you're thinking about your body. And if it's you're thinking about your body, then it's also you're thinking about your relationships. And if it's you're thinking about your relationships, you know, it's you're thinking about the number on the scale. And you know, deeply we know this in psychology, because otherwise what would be the point in giving someone therapy for an eating disorder? Like, we must know that the thinking, if the thinking can change, then their relationship with all these things can change. But I do think that that is so close that we miss it. And so I'll just say that. And when someone says, I'm super scared of pasta, we'll just say, sorry, you're thinking about pasta, sorry, carry on. What were you saying? Or I'm scared of getting on the scale. You're scared of your thoughts, though, or the feelings that are going to come, you think, when you stand on the scale. What were you saying? And I'm not trying to be condescending or constantly interrupt someone. I just want to point it out.
Yeah, absolutely.
Yeah,
absolutely. It's like that thing I know Jamie Smart uses a lot, you know, where, like, if you changed it to a 2-year-old with their teddy bear, like, nobody really believes that they're getting the comfort from the teddy bear. You know, like, the teddy bear isn't. But as we grow up, we all have adult teddy bears, both. You know.
Absolutely.
So yeah, great.
Yeah.
So we have another question from Giles. As coaches, we're always banging on about ourselves, telling stories, using metaphors. Working in the NHS, how much of yourself and your own experience do you share?
So I do that when I think that it's helpful. When I think that it's really helpful for people to, because I think what can happen, I suppose the true answer to that, Giles, is more than I used to. You know. That's the first thing that comes to mind. But again, only with the aim of pointing out that they are not broken because they feel upset. They're not broken because there's not something fundamentally wrong with them because they feel overwhelmed, etc., etc. So I think that any therapeutic relationship, there's dynamics, and what can happen is that people can think, well, I'm not going to be okay unless I have that therapy or unless I'm having that treatment, and then they can sort of become reliant on the therapist. And so I think it's important for me to not let them put me on a pedestal, so be super sort of honest and go, guys, we're all in this together, and just be really human about that. And I really use social media to do that a lot. Like, when I've been in a thought storm or where something's happened, I'll just jump online and go, so here's the thing, we're all human. And I think we're trying to do that, like, with lots of movements actually in mental health, is share and say we all feel this way. And sometimes I think that that's really helpful, and sometimes I think that lots and lots of sharing about mental health problems means that we're not talking about the mental health. Yes. So, you know, when I'm sharing, I'm saying, this is my experience in this moment, but almost deeply, I'm okay too. And so I'm trying to do that. So yeah, I do that. And there are lots of things, I mean, depending on which clinical psychologists and therapists you ask, people would have, mental health nurses, they'd have different thoughts. And we talk about self-disclosure and appropriate disclosure. And for me, it's about just really checking in with myself. Why would I share that story? Yeah. Is that helpful? Is that going to be helpful in this moment to that person? And hopefully, if I'm coming from a clear enough space, I'll be able to feel whether that's helpful or not. Yeah.
And I think it varies amongst coaches as well. I've noticed there's a normal distribution.
Yeah.
Some people do it a lot, and others less so. It's very good. Thank you, Giles. So over to you then, guys. Anybody put your hand up if you have a question or just something you want to share from your own experience that seems relevant to you in the light of this evening's conversation, or just an observation. Yeah, Anthony.
Oh, can you hear me okay? I'll give it a go. So let me know if I'm breaking up. But one of the things I notice a lot is the difference perhaps in business or private work, where I guess in the NHS we have a lot of people who refer to us whether they're ready for change or not. And the early conversations and trying to help them understand what to expect from therapy. I think that is often a difference I probably pick up on. Whereas I'm imagining outside of the NHS, somebody has kind of already sort that out in a way. Not that they haven't in the NHS, but I think there's a mixture of where people are at and being ready for change on that.
Okay. So say a bit more about the implications of that difference that you've seen.
Yeah, I think there's an expectation in the NHS that once we meet someone, we're expecting them to make changes straight away, and there's a time frame, and we're offering so many sessions of therapy, and by 20 sessions you are hopefully going to have made lots of dietetic changes, psychological progress. And I think sometimes we get into a place when that perhaps hasn't happened, wondering then what to do, and it might be about recommending a break from therapy, coming back at some point. And the challenge of trying to fit everybody's needs into a framework, a time frame, which we are kind of imposing in a way.
Yeah. Thank you. And I think that's an important point. Brilliant.
So what we try and do with that, isn't it, Anthony, is we just try and call that out right at the beginning, don't we? More and more like that. This is, this is happening like this because of stuff to do with referral criteria and commissioning. We know as humans that you may or may not see something new in these 20 weeks that we have together. And I always try and say to people, this is you are going to be alive for a long time, hopefully, and this will be part of that journey, rather than, because there is a sort of feeling often, isn't there, amongst our patients, where they'll sort of feel like I have to do this in this time, and we need to be really clear that we all understand that that's unlikely, and that it's ongoing and ongoing and ongoing, like you said to me, Kim. So this is what you're seeing now. I remember once I was doing a presentation for the staff, actually, and it was like January, and I was doing the presentation in September about innate health, early doors, and I was like, I'm just doing my PowerPoint today, and you were like, that's interesting, why don't you wait? You might have seen something new in September. And I was like, no, I have to do my PowerPoint now, because you get sort of conditioned, I suppose, into thinking that you need to pre-plan and have it all structured and set up. And so I suppose for me in the work that I'm doing with the staff, it's very much like, yes, we have these pathways, we have these therapies, but whatever happens in that moment, in that hour between you can't pre-plan that, and that's good. That's a good thing. That's not a bad thing.
Yeah, absolutely. Brilliant. Kevin, coming to you. Sounds like you have a question.
There you go. It's not so much a question, but
okay.
I wanted to share my own experience really about the mind-body connection, and how important from a personal perspective I think that is. Is that okay? Is that the kind of thing that you were looking for? In January, I had a brain seizure, and with complications, and I had to learn to walk and talk again, which apparently isn't normal. And so the specialists thought that it was linked to, because I had an underactive thyroid, they thought it was autoimmune, so my immune system attacking my body, which turned out much later on to be not sort of dismissed, but really down the bottom of the list. So I spent 9 weeks in hospital, and it was touch and go a few times. I nearly didn't make it. And so I had this insight one day, and I thought, I can't even remember what it was. I kind of know it, but I can't speak of it. But it was yeah, and so it was more or less along the lines of, well, are you just gonna wallow in this, or are you gonna get better? Are you just gonna lie here in bed and there's nothing much I could do at the time. I couldn't walk properly, and but you know, that difference between wallowing in it or seeing something new, or being open to seeing something new in each moment, that became very important. And I had all of these tests, reams and reams of tests, and nothing was conclusive. And I left hospital at the end of March, and I was going to say determined. That's not the right word. It's that kind of it coming from the inside. I knew that I would walk again properly. I knew that I would be okay. And conviction is the wrong word too. It's not. It's that just following, just listening to, and doing those things that you think are necessary.
Yeah.
And then, so I began to walk properly again, probably end of May, I think. End of May. Everything was going well. I was starting to go back to the gym and starting to swim again. And all of a sudden, it felt like a calf strain, but I wasn't walking properly. I couldn't walk very far. I couldn't walk to the end of the street, which is about 100 meters. And I thought, oh dear. And I went back to the specialist, and I was admitted to hospital for another 5 weeks. And I had tests for cancer and all sorts of horrendous stuff, and I still haven't found anything. But thankfully, again, it's beginning to go out. They've diagnosed Cauda equina syndrome, but it's not. Cauda equina syndrome is where there's an issue with the neural network, the nerve network, serving the legs, where the nerves exit from the lower spine, and so the impulses aren't reaching the correct velocity across my pelvis,
right.
So, but it's not classical. It's not a classical case in that there's no impingement. So I don't have any soft tissue that's pressing against any nerves, according to the scans. And so I thought, well, that's great. At least that means that I can get better by myself, knowing that there isn't anything there that's physical. And I'm still not walking properly, but it's getting better every day. I notice something that's different. And it's funny with the medical profession. I went to see my specialist Tuesday, and she said, well, you still got a thing with your walking, haven't you? And your pelvis isn't very... And I'm like, wow, you're just missing... So she didn't look properly. I could tell she wasn't looking properly. She has been great, but... and she was like, well, you know... And I said, well, it's getting better every day. And other people have commented on it. And so, you know, I just couldn't believe. But so, yeah, particularly recently. So what does all of that mean in terms of application? So it's all very well, you know, Jamie Smart talks about this in terms of the difference between an embodied understanding and an intellectual understanding. And I think for me, it's been a rude awakening, I suppose, in that it's almost like a test of, well, do you want to see if it's really embodied understanding that you've had, or do you want to? Because I quite often say to people, you know, I like Gabor Mate. I don't know if anybody's come across him. He's well worth listening to. A physician who thinks that repressed emotions and stress are responsible for everything that we encounter health-wise. And I love his work. It's just so refreshing to hear a physician come out with that kind of stuff. And so in terms of what does all of that mean then? Well, it's a hell of an invitation to go deeper into it, I suppose. And really test, you know, I can honestly say that I identify, you know, that shitty thinking that, as Michael Neal calls it, I can identify that much quicker and go back to that place of stillness and just hang out there. And it's such a beautiful place to be, and you know, and be open to those insights. So you know, I'm hoping beyond hope that it's going to continue, and one day I'll be okay, and everything will be good. But yeah, it's really deepened deepened my understanding in the embodied part. So just really wanted to sort of speak about that. And I think there is so much hope there for so many people that isn't being explored. And the NHS, I mean, they do some great work. I can't, they've saved my life twice. If I got a pair of broken legs, which I did when I was 4, I don't want acupuncture. I want to be in a hospital. Thank you. But it only goes so far. And I think there are so many people out there that could possibly benefit from this. And
that's
all I wanted to say, really.
Yeah, thank you very much, Kevin. I'm glad you shared that.
And I think, Kevin, thanks for sharing that. And I think just for people to be able to listen to what you've just said, and the year you've had, my goodness. And yet here you are saying, I'm so grateful for this understanding, and I've learned so much. And wow, what a place to be able to, I'm sure you're not always feeling this reflective about it, but in this moment you're able to be, and that says a lot, doesn't it?
Yeah. It's funny as well, the language, going back to language. I like that Bruce Lipton thing, how he says that language is a barrier, is an encumbrance to to self-expression and stuff. And the amount of times I've heard specialists saying, I bet you must be frustrated about, I bet that's awful for you to. I'm like, why don't you ask me what I'm, because to me, I didn't have any of that stuff. I was lying there in hospital, and I let go of it and thought, I'm just going to make myself worse potentially here. I'm just going to let go of all of this. I didn't worry about what the test results were going to be. It didn't even occur to me. I just knew that at the end of the day I would be all right. Or
do you know what, Kevin? That's just made me think of something about how important it is to not make assumptions. And I think that when we're busy and we've got a busy clinic and we're trying to be super helpful and we're running around and we're doing all these things, especially any specialism, whatever it is, you hear similar stories a lot of the time. You do, that's why you're able to say, certainly in eating disorders, you are able to say, people will often talk about it as a coping strategy, as a way of communicating, because that's what a lot of people say. And the reason I mention that is because I had a patient months ago now where I was sort of doing my thing and in my flow, and I said, and so I imagine that you're feeling this way and this way, and she went, can I stop you? I don't feel any of those ways. And I was like, oh. And that's within this understanding. And I had forgotten in that moment to just have space and listen and actually go, well, you tell me, And I think that's so important. That's so important. That's such a huge thing about inequality, isn't it? And actually, you tell me where you're at, and let me see what it looks like from your reality. Let me not tell you what I think your reality is. Let's hear it from you. I think that's huge. Yeah. And I also think that we, obviously as a drama therapist, Kim, I was trained to look at metaphor and images and story and music, because language so often gets in the way, and so often people will instantly have an emotional response to a piece of music or a symbol or a picture or an emotional response will often come from metaphor. And we know this because that's why we're always sharing metaphors, aren't we, in this understanding. But just more generally, I'd love to use this call to kind of invite people to go, don't stop with talking, it's all right, but there's loads. Have a go, and don't think, oh, I'm not a creative therapist, or I'm not a creative, God forbid, don't say I'm not a creative person, I can't do it. It's like, there's just so much rich material and ways of helping us to really see what it looks like for somebody else. And talking is not the best.
Yeah.
My opinion. My reality is that it's not the best. That.
Thank you, Kevin. Thank you, Mary. Nice to see your face. How was your tea, Giles? Good. Okay, excellent. So we've just got about 10 minutes left. Anybody else wants to raise a hand, say something, ask something, add to something? Yeah, Tracy.
Not sure how good the internet connection is. Just okay, yeah. Yep. Everybody here?
Yeah, just about.
just about. I'll type the question.
All right.
It's to do with them, yeah, in the mental health workplace. You know, I don't know if you can hear me. Can you hear me? Okay.
Just about, babe. Go on, go with it.
Right, okay. So, you know, maybe doing some absolute work in NHS, point out, you know, these people are coming to you. So you actually that environment where you're dealing with mental health on a daily basis.
I can't hear you, babe.
You know,
Sorry. I'm going
I'll
to type.
Yeah, thank you. Sorry about that.
Sorry.
Okay, just while she's doing that, anybody else? Giles.
I want to say thank you, Kevin. That was wonderful to hear. It really really struck me. I haven't read any of Bruce Lipton's stuff. It's on my reading list.
Fantastic.
But I'm doing a course with Bill Pettit at the moment, and it's absolutely blowing my mind because that whole I'm seeing it more and more clearly. Just that a chronically activated stress response, just the havoc that creates, you know, not just mentally but physically as well, because, you know, it's been designed to be used. The fight or flight has been designed to be used for a very short period of time, and here we are, you know, day in, day out. And to think that you know, it seems like it's a lot more mainstream these days, that, you know, oh yes, I know that stress is, you know, makes me unwell, and yet no one's looking at what's causing the stress. It's just everyone's so focused on circumstances and their lives that I think it's really hopeful. I think you know, I'd like to think the tide is turning anyway. So that's my bit.
Thank you, Giles. Come on, Tracy.
Type.
Oh.
And whilst there's a pause, Kim, just to say that, you know, just for if there's people are watching this recording, just to sort of flag up Rebecca, who's sitting quietly in the corner over there, who wrote a beautiful book called Recovery from Within about her, I'm just speaking as if you're not here, Rebecca, but her journey with her daughter Beatrice through their through Beatrice's anorexia, and our consultant did a forward for the book for you, didn't he, Rebecca?
As did you.
Yes, yeah. And as did Amy. So, you know, I think it's just wanting to point that out, that I do think too, Giles, that there's a tide turning and we're getting much more comfortable. It's taking time, but we're getting more comfortable with sort of talking about other approaches and other ways of seeing things. And, you know, let's be honest, if it wasn't for the open-minded approach and heart of our consultant, Dr. Rhys Jones, and Dr. Shellhauser, who's now the clinical lead, that I wouldn't be as far on as I am, because they were like, okay, well, let's see, you know, let's not dismiss it out of hand. So I do think people are more open and continue to be open, more than they were perhaps. So I think that's great. Thank God, hey?
Fabulous.
Have we got a question from Tracy?
Yes, we have. Can you read it, or do you want me to read it?
Go on, you read it, babe.
Okay, so Mary, you work in an environment dealing with mental health on a day-to-day basis. In the corporate world, it's difficult to even raise the subject of mental health, never mind talk about it. Fortunately, I'm in a business where we've created a culture where we can talk about it. However, the solution seems to be to just talk about the problem and then point people in the direction of the professionals. How can we start to create an environment where we talk about this understanding?
Where we just take
wherever we work. Yeah.
Well, I'm probably not your girl for that one, babe, to be honest. Kim, people who do this in business. I mean, I'm Kim.
Yeah. Well, I think don't wait for permission is the first thing I'd say. Like, you know, if you without being evangelical, without shoving it down people's throats, you can you can certainly deeply listen to people without being a so-called mental health professional. You can be a good friend, and you can just begin to share your own understanding where that's coming through you, and it seems to you that it would be helpful. You know, people do that all the time in what I think might be a not very helpful way. You know, just sitting and bitching about it. So yeah, I don't think there's a don't wait for permission. And I think the more people see this understanding for themselves, the more that will happen. I've got lots of clients who've started, honestly, a complete transformation in their own organisation, and it's not their job to do that. Yeah.
I think one of the things that did come to mind there is that when I was first trying to share this in our organisation, which wasn't perhaps as easy as I might have made it sound, it was, what will the benefits be for the staff if we do this? And I wonder whether for you, Tracy, it's like, well, what will the benefits be? And I know that, Kim, you work in business and you talk about sort of productivity rising, or potentially, you know, less burnout and less people going off. And, you know, we talked about that, Giles, haven't we, in our group recently, about, well, why will we get people interested in this potential innate health solutions work in the NHS? But we could perhaps reduce burnout and stress, and, you know, and people going off sick. So maybe, Tracy, that would be a way in, of you kind of saying, you know, I've got this understanding, I've got something to share that doesn't need years and years of training, and perhaps doesn't even need a professional to do it. And it could hit these targets that we've got in terms of, you know, stress, burnout, whatever. And I'm thinking about a company that I'm working in. So I do a bit of private work too, and I'm working in a private set of day nurseries. And we've just decided that what we're going to do is have a mental health champion in each of the nurseries, and that person is going to be there just to sort of nudge people back to their wisdom. And the purpose of that, which is true, we're not lying, is to help reduce the amount of people who are sort of coming into work super stressed and perhaps going off and being signed off for a week or two. So I just think, you know, think about what are your company's objectives and show how this can meet those, or some of them, maybe. Yeah,
brilliant. Well, that's about our time, folks. Mary, thank you so much. Really appreciate it. I will post the recording and let you all know the link. I appreciate everybody that's come along, and yeah, enjoy the rest of your evening. Brilliant.
Thanks so much, everybody.
All right, thank you all for coming.
Bye.